Well, thank you very much for joining us this morning and today. On behalf of the National Collaborating Centre for Methods and Tools, it is our pleasure to have you here in Toronto with us today to talk about preventing childhood obesity. An event like this takes a lot of partnerships, everyone working together. So just in terms of how this was possible for today, this is being funded by the National Collaborating Centre for Methods and Tools, which is funded by the Public Health Agency of Canada. So we're very grateful to have the opportunity to bring folks from across the country together to debate and discuss what we do moving forward in preventing childhood obesity. Okay, so just a little bit about the objectives today. We want to focus on learning about emerging effectiveness evidence about what works, also more as well what doesn't work in obesity prevention, emerging evidence on inequities, examples from frontline public health practice about putting this information into practice, and then finishing the day with some tips and strategies around integrating social determinants of health lens into our work, discussing these findings with colleagues, and then beginning on developing a work plan. So just a little bit about the National Collaborating Centre for Methods and Tools. Our vision is the effectiveness and efficiency of Canada's public health system will be guided by the production, sharing, and use of high-quality evidence, with the understanding that the word evidence is a really loaded term, and that evidence means different things to different people. Today we're focusing on two types of evidence: effectiveness evidence and evidence around SDOH factors. We know that there are many other types of evidence that go into decision making, and we're not diminishing the importance of those in public health decision making. We're just not focusing on them for today. Our mission with the NCCMT is that we'll enhance evidence-informed public health practice and policy by providing leadership and expertise in supporting the uptake of what works in public health into practice. And what this really highlights for today is a continuum of services that we have from healthevidence.ca through to the NCCMT, where health evidence is putting into one place the effectiveness evidence in public health, and NCCMT is really interested in helping public health put that evidence into practice as it is relevant, appropriate, feasible, applicable. Just a little bit about the various ways in which the NCCMT is trying to support evidence-informed practice in public health. We have a number of services that we provide. Many of you may be familiar with the Registry of Methods and Tools. This is, we've been compiling in one place tools that run through the whole list of skills for evidence-informed decision-making. I'll show you that in a moment. But putting in one place the tools that are available to help develop knowledge, skill, capacity, infrastructure to put evidence into practice. And that is available freely online. We also know that it's not just about having access to the information, it's about learning, obtaining the knowledge and skills. So we have a number of online learning opportunities. Some of you may have already used our evidence-informed decision-making module that's online, which basically takes you through the beginning learnings of how do I go about forming a question, how do I then search for evidence, how do I know if it's good enough to use. So there's a number of modules that we've been creating and putting online that you can do at your own pace, stop and start, and start to develop those skills. We're running workshops across the country. This is the first time we've ever done one to include the whole country. Usually we've done them more on a provincial basis, and they have really focused on specific steps in the evidence-informed public health process that we've been looking at in those workshops. Some of you may be familiar with Public Health Plus, which is a system that is searching the evidence for new, emerging, newsworthy evidence in public health that is of a good quality and pushing that out to you. Sometimes those are reviews, sometimes those are single studies, but it's allowing you to keep up to date on those pressing, emerging new ideas. We also have a number of webinars, and again, it's also very important for us to be encouraging networking, supporting networking, bringing people together across the country to discuss. So as many of you know, we have a fair amount of evidence that's been compiling. When I first started thinking about evidence-informed decision-making many years ago with Donna Saliska and Sarah Hayward, some of you from Alberta would know Sarah, we first started thinking about this back in the early 90s. And at the time, Donna and Sarah and others were starting to do systematic reviews evaluating what I had done as a public health nurse and what many of you are doing. And very quickly, we started to realize once these documents were sent out, they seemed to get lost. So what was happening to them? And really, we still have that issue today where there is evidence. And one of the things I would hear many times is that, well, there is no evidence in public health that answers my question. And what we actually really have, and particularly as it relates to chronic disease prevention, is almost too much evidence. We have hundreds of reviews that consist of thousands of studies evaluating different ways in which to promote physical activity, healthy eating, prevent sedentary behaviors. We have a huge amount of literature that's relevant for us that can help guide us. And what we know is that there's a gap between that evidence and what is actually happening in practice. And really, sometimes we have two very extreme activities happening. We have evidence of what we could be doing, and that's not happening in practice. We also sometimes have innovative ideas that get taken up very quickly into practice, and then everyone wants to do them, so we start doing them, and then when we do some more rigorous evaluation, we find out they're not actually achieving the effects that we were hoping they would, and now we have to think about, should we not do that anymore? So that evidence transfer gap is really where we are in terms of what the NCCMT is all about, is trying to close that gap between what we know and what we're doing. A little bit about, because it's not just the NCCMT, there are 6 national collaborating centers funded by the Public Health Agency of Canada that span our country. We have the NCC for Aboriginal Health, which is located in Prince George, BC. We have the NCC for Environmental Health, located in Vancouver. We also have NCC for Infectious Diseases in Winnipeg. We're located in Hamilton, just down the road. We have the National Collaborating Centre for Healthy Public Policy in Quebec. And then we have the NCC for Determinants of Health in Antigonish, Nova Scotia. And together, all of us have a mandate to produce knowledge relevant for public health and to share that knowledge with the public health community in Canada, and then to promote the uptake where appropriate and feasible and practical into practice. Just a little bit more about that. This is acute care data, but I don't think we have any reason to believe that it isn't the same in public health. So we've known for a number of years that a fair number of patients do not get treatments that have proven effectiveness, and we know that about a quarter of patients are receiving care that could be potentially harmful for them. So these are important issues that we are grappling with. We're working towards getting better. We need to continue to work towards getting better. Flip then to this, my favorite model of evidence-informed decision-making. But what this model allows us to do is to start discussing what's missing, what's there. And certainly very much, this model would depict that there's an understanding that the decision-making we're all involved in with respect to public health is very complex. It isn't just about saying this study says we should do X and therefore we do it. There's resources, there's community preferences, political will. There's so many things that come into play. And that's what this type of a model illustrates, is the complexity of that, and very importantly, the bringing together of that public health expertise. So our job is to be able to make sense of all of this other ways of knowing that exists, and also with the practice that we've been doing and knowing our communities, hearing from our communities, how do we actually then modify a program that maybe worked somewhere else and looks promising here, but needs to be changed in order to suit, let's say, different geography. For us at the National Collaborating Center for Methods and Tools, it helps us break down what are the skills that folks need in order to be able to work through this process. It starts with defining a question. What is the issue that we need some solutions to? And then once we are really clear on what that is, then how do we search efficiently and effectively so that we're not spending a lot of time? There are some tips that we can learn along the way in terms of how do we do that? How can we search efficiently so we're not actually using a lot of time and not finding what we need? So I'm just going to try to keep moving us along. How do we tell when evidence is good enough to inform our practice? And 20 years ago, this was very black and white for me. There's good science and there's not so good science. And now, actually about 5 years ago, I changed that wording, and it really is, what is good enough to inform what we do? Because there's no perfect research study out there, and certainly as you learn critical appraisal skills, you can always find something wrong with any study that is out there. And we have to draw the line in terms of, is this good enough? Yes, there are some issues that could be better, but it's good enough. And the issue that we might want to think about there is, if there are flaws, then perhaps we will be cautious about the findings. So if a study has some flaws, tells us that an intervention actually has a statistically significant effect, well, we might need to scale that back a little bit. Is it really as big as the effect that they found? Because that's what flaws in research do, is they might overestimate an effect. Now, if we have 5, 6, 7, 10, 25 studies all evaluating a similar program, how do we pull that all together? And then are there systematic reviews that answer? Coming back to the how do we adapt that? There are some tools. You'll see that today. How do we see if this is appropriate for our setting? And then if we make a decision, we're going to make some changes to our program, how do we go about doing that? How do I make those changes throughout a region, throughout a health department? What policies need to change? What training needs to happen? And then finally, and then we would start the process all over again, but in evaluation, how do we know that any tweaks we've made to our programs are actually helping us achieve what we want to achieve?